What are the genetic risks of FSHD for family planning? Facioscapulohumeral muscular dystrophy, often shortened to FSHD, is a genetic condition that primarily affects muscle strength and function. If you or a family member has FSHD, understanding the genetic risks involved in family planning is crucial. FSHD is inherited in an autosomal dominant manner. This means that if a parent has the condition, there is a 50% chance that each child will inherit the altered gene responsible for FSHD. There are two main types of FSHD. FSHD type 1, which accounts for about 95% of cases, is caused by a deletion in a specific region on chromosome 4. This deletion is linked to the severity of the disease and the age at which symptoms appear. However, symptoms can vary widely even among family members who share the same genetic background. FSHD type 2 is less common and involves mutations in different genes that affect how the DUX4 gene is expressed. Like FSHD type 1, FSHD type 2 also follows an autosomal dominant inheritance pattern, but it requires mutations into genes. When considering family planning, it's important to note that not everyone who inherits the FSHD mutation will show symptoms. This is known as incomplete penetrance, and it means that some individuals may carry the gene but never develop the condition. The variability in symptoms can complicate genetic counseling and risk assessment for families. Genetic testing can play a vital role in understanding the risks for family members. It can help identify specific mutations and clarify the likelihood of passing FSHD to children. For those looking to reduce the risk of transmission, options such as prenatal diagnosis and preimplantation genetic diagnosis are available. Most pregnancies in women with FSHD proceed without major complications, but it is essential for healthcare providers to monitor potential risks related to muscle weakness and respiratory function during pregnancy and delivery. For anyone affected by FSHD or with a family history of the condition, seeking genetic counseling is a wise step. This can provide clarity on the 50% inheritance risk, the variability of symptoms, and the options available for testing. Understanding these factors can help families make informed decisions that align with their values and medical advice. In summary, the genetic risks of FSHD in family planning revolve around its autosomal dominant inheritance pattern, the variability in symptom expression, and the availability of genetic testing to guide reproductive choices.